Assalamu alaikum students. Today our topic of discussion is anemia. So first of all its definition. Anemia is the blood disorder characterized by the reduction in red blood cell count, hemoglobin content and packed cell volume. You know what is the normal red blood cell count and what is the normal hemoglobin content, and also about normal packed cell volume, that is the hematocrit. So when these three things are reduced, there is anemia. So it is very important definition regarding anemia. Classification of anemia, first of all on the basis of cause and second on the basis of morphology of RBCs. On the basis of cause, there is blood loss anemia, inadequate production of normal blood cells, excessive destruction of blood cells, and on the basis of morphology of RBCs, there is a normocytic, macrocytic and microcytic anemias. Normocytic means that is normal size, macrocytic means larger size and microcytic means smaller size. Classification according to morphology of RBC, the average size of RBC provides a convenient and informative framework to categorize the various types of anemia. So first of all, there is anemia, normocytic, microcytic and macrocytic, which are categorized on the basis of mean corpuscular volume. So normal mean corpuscular volume is 80 to 100 femtoliter, while when less than 80 femtoliter, that is microcytic, and when more than 100 femtoliter, that is macrocytic. Normocytic normochromic anemia, the primary cause reduction of number of RBCs. So there is not decrease in the number of, there is not decrease in the size of RBCs and not even decrease in hemoglobin content, because chrome is the color, so color is due to the hemoglobin content. So there is only reduction in number of RBCs in normocytic normochromic anemia. There is no decrease in size and no decrease in hemoglobin content. So the causes are endocrine disorders, hypopituitarism, hypothyroidism and hypoadrenalism, hematological disorders, aplastic anemia, hemolytic anemias, acute blood loss, anemia of chronic diseases. You can see here the comparison between normal and normocytic anemia. So in normocytic, you can see there is reduction in number of RBCs, while the size is normal, the color is normal. So normocytic anemia can be presented with elevation of reticulocyte count or a reduction of reticulocyte count. Elevated reticulocyte count has the reasons include blood loss anemia, hemolytic anemia, while normal or low reticulocyte count has the reasons like bone marrow disorders, chronic diseases and kidney diseases. Well, regarding microcytic anemia, many RBCs smaller than normal, mean corpuscular volume less than 80 femtoliter. The RBCs are usually hypochromic, mean corpuscular hemoglobin less than 27 picogram, increased zone of central pallor, and cells are various in shape and size. Iron deficiency anemia, first one is, and it is the most common type of anemia, develops due to inadequate availability of iron for hemoglobin synthesis, and its morphological picture is microcytic hypochromic anemia. So this microcytic hypochromic anemia, this morphology is very important. You have to remember the morphology in each type of anemia. and it is the most common type. So features of iron deficiency anemia: first of all, pallor, that is yellowishness, brittle nails, nails become fragile, easy to break, atrophy of papilla in the tongue, dysphagia, difficulty in swallowing, general weakness, cracks in the side of mouth, dizziness, chest pain, fast heart rate, frequent infections, shortness of breath, headache, and restless leg syndrome. And then pica, that is tendency to eat soil or rotten things. So these are the features of iron deficiency anemia. You can see here normal versus microcytic morphology, and in microcytic the arrows indicate that there is a central pallor zone, and the cells are smaller in size as compared to normal one. Macrocytic anemia is the megaloblastic anemia or the non-megaloblastic anemia. So megaloblastic anemia is very important, and it is due to the deficiency of vitamin B12 or folic acid, and also due to the abnormal metabolism of folate and vitamin B12. While non-megaloblastic anemia is due to liver diseases, alcoholism, post-splenectomy, neonatal macrocytosis, and stress erythropoiesis. Very important after iron deficiency anemia is megaloblastic anemia. Deficiency of maturation factor called folic acid. RBCs are not mature, DNA synthesis is defective, because for DNA synthesis folic acid is important. So if there is folic acid deficiency, DNA synthesis is defective, and RBCs cannot mature, so remain in immature stage, that is blastic stage. As you know, the immature stage has larger size, while mature state, that is erythrocyte, has smaller size. So the immature cells has larger size. That's why this anemia is called megaloblastic. Mega means large. And RBC's morphology on a microscope is macrocytic hypochromic. The cells are larger in size, while the hemoglobin content is less, because the cells are in immature state, so the hemoglobin content is less. The hemoglobin content is maximum in the mature state, that is erythrocyte. Pernicious anemia due to deficiency of vitamin B12, due to atrophy of gastric mucosa, because of autoimmune destruction of parietal cells. The parietal cells actually release the intrinsic factor, but when there is destruction of parietal cells, there is less production of intrinsic factor. This intrinsic factor is important in the absorption of vitamin B12. This intrinsic factor combines with vitamin B12 and allows the vitamin B12 absorption at the level of ileum. So when intrinsic factor is in less amount, less absorption of vitamin B12 occurs. So there becomes deficiency of vitamin B12 in the bloodstream. The cell morphology is same as that in megaloblastic anemia, that is macrocytic hypochromic. You can see here the larger cells in macrocytic as compared to normal ones. So the anemia on the basis of cause is divided into impaired production, hypoproliferative, blood loss, hemorrhage, increased destruction, or hemolytic. So we will discuss them one by one. Reduced RBC production include different causes like stem cell defects, nutritional deficiency, erythropoietin deficiency, hormone deficiency, inhibitory effects of cytokine, aplastic anemia, iron deficiency anemia, chronic renal failure, hypothyroidism, chronic diseases. So these all are the reasons behind reduced RBC production. Increased loss. First one, anemia due to hemorrhage, that is acute blood loss and chronic blood loss. Acute blood loss occurs in road traffic accidents where massive blood loss occur, and in chronic blood loss, loss of blood by internal or external bleeding over long period of time. For example, in peptic ulcers, lot of iron loss causes iron deficiency. RBC morphology will be same as that of iron deficiency anemia, that is microcytic hypochromic. Hemolytic anemia is divided into inherited and acquired. In inherited, that is, there is red cell membrane defects, hemoglobin abnormalities, metabolic disorders of RBCs, and in acquired, there is immune and non-immune. So in inherited hemolytic anemias, there is red cell membrane defects, include hereditary spherocytosis, hereditary elliptocytosis, and hereditary stomatocytosis. So we will discuss them one by one. In hereditary spherocytosis, there are actually two proteins, that is the spectrin and ankyrin. So when these proteins enable the RBC to have biconcave shape, but when there is a genetic defect in the production of these proteins, that is the spectrin and ankyrin, that leads to the spherical shape RBCs. So that's why it is called hereditary spherocytosis, because it has a genetic link, and there is abnormal production of ankyrin and spectrin. You can see here the spherical RBCs in hereditary spherocytosis, while in elliptocytosis you can see the elliptical shaped RBCs, and in stomatocytosis there is the central pillar zone. If you look at the central pillar zone, this is in slit-like appearance. This is in slit-like appearance. You can see here, slit-like, slit-like. Inherited hemolytic anemias. From here, we will continue our second segment of anemia. So if you have any query regarding the first part of anemia, you can contact me. Thank you.